All right, well, welcome everyone to our session on the nuts and bolts, turning educational projects into successful submissions at MedEdPORTAL. I'm Josh Timpey. I'm professor of emergency medicine at the Medical College of Wisconsin, and it's my pleasure today to introduce our speakers. First, we have Jared Cutson. He's an associate professor of emergency medicine and medical education at the Icahn School of Medicine at Mount Sinai and the director of emergency medicine simulation at Mount Sinai Hospital. We also have Mike Cassara. He's an associate professor of emergency medicine at Zucker School of Medicine. He's the director of simulation for the Department of Emergency Medicine at North Shore University Hospital and the medical director of North Shore Health Systems Patient Safety and Institute of Emergency Medical Institute. We also have JP Sanchez, who is a professor of emergency medicine in New Mexico. He's also director of diversity and inclusion. And Dr. Sanchez is also on the editorial board at the Journal of Academic Emergency Medicine and an associate editor for MedEdPORTAL. And then we have Rebecca Burns, who's an associate professor of pediatrics at the University of Washington School of Medicine in Seattle, and a board certified pediatric emergency physician at Seattle Children's Hospital. So with that, let's get started.
Great, thanks, Joshua. And we want to make a special note. Dan Meyer is also listed as a presenter, and Dan unfortunately can't join us today. He had some surgery a few weeks ago and is still recuperating, so we send our best to him. But we want to thank everyone for joining us today. We are going to ask if you can, and I know JP has, even though he's not in an ideal location, if you can turn on your cameras for us. JP is on a train and he may have disappeared there as he was going through a tunnel somewhere. But to begin, you heard our introductions. None of us have anything to disclose. Just a quick mention that all of us who are presenting today are associate editors for MedEdPORTAL. And Mike will jump in and correct me if I'm wrong, but Mike and JP, I think, are for emergency medicine. Rebecca is for pediatrics. And I am the associate editor for simulation. Although as submissions come into each one of those content areas, there's a lot of cross-pollination and we see things in all different categories. So lots of experience here in terms of getting your educational scholarship published. So our objectives for today to identify the MedEdPORTAL submission process, to describe the common pitfalls of unsuccessful submissions, and appraise submissions critically as a peer reviewer. And so just a point of clarity, MedEdPORTAL is the AAMC's open access MEDLINE index journal. It's peer-reviewed medical and dental educational resources. It includes all the materials needed to implement the curriculum, and you as the author or the authors who submit there do get to keep their copyright. And as Mike pointed out in the chat, MedEdPORTAL is an actual journal. But before we move on any further, there's only a handful of folks in the room, but if you would be so kind just to type into the chat your name and where you're from, and if you have any experience either authoring or reviewing for MedEdPORTAL or another journal, that would be really helpful. So if you could just take a moment to do that in the chat, we'd appreciate it.
Be afraid to place a couple of items in the chat there also, so that we can really tailor this time that we have together for each of you.
So Wendy from the University of Maryland, you've utilized resources from MedEdPORTAL. That's always nice to hear. Leela, currently writing an article. Okay. Keelan, an MS3 at Toro, no MedEdPORTAL experience, but excited to learn. Excellent. Sarah, and have not, from University of Colorado, have not submitted, but utilized it a lot, which is always great. Alex from UMass, looking to publish their recent adventures in curriculum redesign. Great. And at Alex Nordberg from UMass and Alex Monroe from Emory, considered MEDEDPORTAL submissions, but intimidated by rumors of lack of success. We will we will hopefully dispel some of those rumors. So great. And Sarah Lynn from Vanderbilt, utilize MEDEDPORTAL review for other EM journals. Great. So here's our agenda. We're gonna do some breakout groups, but what we're actually gonna do is we're gonna keep everybody here. We have a little bit of a virtual game that we are gonna have you all play. We know Zoom gets to be a little bit tiresome at points in time, so hopefully this little bit of an exercise will be engaging. We'll debrief the answers, we'll review some examples, and then we'll have some time for wrap up and to be able to answer any of your questions that you have about the submission process. So actually what I'm going to do is I'm going to, just for ease of this, actually, do I have a volunteer who's willing to share their screen if I send them a link? I'd rather not control it myself. So is anyone willing to open a link and share their screen to help facilitate the gameplay?
I can do that if
Joshua. All right, so Joshua, I'm going to send you this link, and you can go ahead and click on it. I'll open up a website for you. Super important point is I'm going to stop sharing. When you share your screen, there'll be a little icon in the top corner or lower corner on Zoom, actually, where it says share your computer audio. If you would be so kind to share your computer audio as well, that would be great. And at this point, we're going to let Joshua control the screen. We're going to have everyone else sort of, if you would, take yourselves off of mute, and you'll have a bit of a conversation with each other. It is a time game. So this is a little bit of a game. The screen should not be shared. You can use your electronic devices to assist you as you navigate this short game. Myself and Mike are here to assist you as necessary. And the team, if we had teams, but those who get them, we know how others have done. Those who get the most correct in the shortest amount of time will win. And the next button is available for you to use. So go ahead and click next.
Hi, my name is Dan, and welcome to the SAEM presentation, Nuts and Bolts, Turning Educational Projects into Successful Submissions to MedEdPORTAL. This is a hands-on workshop. Well, as hands-on as we can make it via Zoom. I'm going to guide you through the next few slides, and then I'm going to turn the controls over to you. Follow me into the library by clicking Next. Rumor has it you can uncover a hidden message by answering questions placed among the books. But first, you should introduce yourselves so you know who you're getting into this with. Either verbally or in the chat, quickly say hello to each other. But don't take too long. We've got lots to do.
So you've obviously already done that in the chat, so you can just click here on the screen and continue on. So this is just the instructions. There's some questions on the following pages. They're interactive, so you can click the arrow to continue, and you should all discuss the questions. You do get 2 chances to answer each question, but only 2 chances, but also only 7 minutes, and your time's going to start when you click the arrow.
Are you ready?
All of the above.
And then where do you want me to go from here?
So there's the number 2 on the book on the lower right. It'll just go in order.
I cannot see the chat now. So if there's something written in there, please let me know. Otherwise, someone to tell me.
There's nothing in the chat so far. I'm monitoring the chat for you, Joshua. But what do people think about this question?
I know that the first 2 seem reasonable to me. I'm less sure about the ebook and the validation. That seems less MedEdPORTAL-y.
I'll pick ebook, but I have no idea.
I guess ebook as well.
You get 2 tries.
I'm hearing the most for ebook. Is that? Try that.
Let's go with it. Okay. Validation study then?
Okay.
I'll say 43. But I have. Nope. Somebody else?
We'll be optimistic and say 51. Sorry.
It's 12. Wait, what's the answer?
We don't know.
We'll go over it at the end.
Is this trying to get at licensing of images? So not the one that says Shutterstock, but everything else, I can't really tell.
Everything else?
Yeah, that or one that doesn't have permissions. And it's from the people whose pictures or likenesses are in there.
So not this one?
It's either that one or Shutterstock would be my picks.
So which ones can be?
So you can choose multiple, it looks like.
Oh,
So I think as long as we have permissions and things are anonymized on the chest x-ray, that's okay. And then I don't know if the play button is supposed to be a video. I'm not sure what's going on there.
Or is that supposed to be
That's a YouTube symbol.
branding?
It's a brand, so no.
Right. So
Chest x-ray.
yeah.
and then I don't see anything. That picture on the bottom could be like a free open access image. It's hard to tell looking at it, but I would venture a guess to say that that one's okay. And the chest x-ray, as long as we said, like we were saying before, no patient identifiers.
And then what was the verdict on this one?
It has a patient in it, so I'm gonna go with no.
You know,
Well,
yeah.
unless it was staged, but no. So, okay.
You said at the beginning that it was medicine and dentistry, so I'm gonna wager dentist.
Josh, you might be able to pull that over, yeah.
Good job.
I bet the simulation, the standardized patients, virtual learning in VR would be.
Would also guess opioids, addiction, and pain.
Just a time check, you have about 2 minutes.
How many more questions do we have?
2.
All right, submit.
I bet there's DEI and public health also. I bet those are.
Yeah.
That sounds good.
In the chat, there was
Wait, no,
oh,
add DEI.
DI.
Oh,
Yeah.
sorry.
Oh no.
Okay.
Josh, you would pull the ones on the right eventually to connect them.
Okay.
Current is curriculum development.
Classic is scholarship.
Kirkpatrick is level of evaluation.
Learning.
Bloom is the 6th level. I
Systems.
think you're right there, straight across.
Great job answering all those questions. Can you unscramble the letters on this page and then enter them on the next slide to solve the puzzle? Click Next to continue.
You guys got the letters?
Looks like submit, but I can't find the T. Where,
Oh,
or-
there
Oh,
it
I
is up
see it,
top
up
in
top,
the
up top.
blue. Yeah, it's hard to see that T.
Oh,
And
one
there's an exclamation point, maybe?
Yeah.
Said submit. Oh, I can type. Yeah.
So go ahead and hit review. You had 19 seconds to spare there. Nicely done. So here's the answers. Mike's giving you the round of applause there. So you're right. Everyone can submit to MedEdPORTAL. You can go ahead and actually, you know what we'll do is instead of going through here, Joshua, if you'll stop sharing your screen, I'll actually pick up the sharing. Excellent. And all right, because we can go through them here. All right. So who can submit to MedEdPORTAL? As we just discussed, anyone can submit to MedEdPORTAL. Any clinical background could be the lead author. There is no requirement that you have to be of any discipline, specialty, or anything along those lines to be able to submit. What are appropriate submissions for MedEdPORTAL? This was the question as to computer-based module or SP case. And we're looking at here is that things like the computer modules and SP cases are acceptable. Content that gets submitted to MedEdPORTAL has to be shareable, has to feature active learning, and focus on an educational activity. An ebook would likely not meet those requirements. Studies, validations of types of trainers, lectures, podcasts probably don't meet those requirements either. And so the three requirements is that it's shareable, it features active learning, and focuses on an educational activity.
Yeah, Jared, I wanted to just chime in there and just say that, yeah, that differentiation is somewhat important because you can, just having the material, like creating, let's say, something that would be within a book, or even if you had the book, and let's say it was something that wasn't copyright protected, it in of itself is not enough to meet the criteria for educational scholarship. You have to build the activity around it. So you'd have to say, well, if a chapter was pre-reading and it was something that could be included as an appendix to the actual lesson plan of materials, then maybe you could have that sort of piece there. But to just dump a book there, it's not like a library repository of content. It's really got to be something that's an active learning strategy centered curriculum to which the book is used as a part.
Thanks, Mike. That's great. Great point. So what is the acceptance rate? The acceptance rate is about 37%. So for those people who were saying earlier that you're a bit intimidated, you heard that MedEdPORTAL rejects everything that comes through. It's not exactly the case. There's the process in which submissions go through is that they get screened by a staff editor to make sure that they meet the essence of what MedEdPORTAL is all about. Once it gets screened by the staff editor, it gets sent to an associate editor who then reviews high level, 20,000 foot view to make sure that all the pieces are there. And as long as and most of those that come through to the associate editors get pushed onto the peer review. Those that make it past sort of that initial screening, you can see there's a high proportion of those that get accepted. And so it's that really that initial screening, things that aren't the right fit for the journal that ends up getting pushed out and sent back to the authors. So
Can you
what?
clarify? I'm sorry,
Yep.
I have a question. Can you go back to the last slide?
Sure.
So what you mean is that 51% don't even make it to peer review, not they're rejected without revisions.
Correct.
Okay.
So it's that initial step where the editorial staff are looking to make sure that what you're submitting is what we talked about a minute ago. It's shareable, it's educationally focused type content, to make sure that it hasn't been copyrighted elsewhere. And Mike and JP are chiming in the chat if you don't see it. But about the editorial staff are helping authors to get their content through. They're not a roadblock per se, but they're making sure that the content is the right fit. And JP was actually saying, in comparison to other journals, peer-reviewed PubMed Index journal, MedEdPORTAL has a much higher acceptance rate. But it is that sort of first gate to get into. Once you get past that, once your submission meets that that criteria that I talked about a minute ago, let me go back here, shareable, features active learning, focused on an educational activity, then you're into the peer review stage, and you can see the acceptance rate is actually pretty high once it gets to that stage.
I was going to jump in on this point, Jared, if you could. So that reject without peer review means that it hasn't even gone forward from the staff review forward to the peer review process yet. And so, while there might be a 51% reject at this point, maybe what's not encapsulated in the slide is, well, so you get the feedback back, look, we're not taking it now. The reason why it might have gotten the reject there might have been some of those things that Jared had just mentioned. For example, you have an image that doesn't meet copyrights, therefore we can't even push it forward because it's going to get rejected here at this point. But you swap out that image or you change other features of the submission, and so then you put it back in the queue. Now it gets assessed, then it goes forward to peer review. Then from there, it could be met with acceptance or reject, or accept with minor revisions, or there's other different levels of the review decision there, but the ones that we're showing here, like if you make the reject without peer review, there's probably something that's almost like it could be very much be a technical limitation of the submission that prevents it from ever getting forward to peer review. So it hasn't been read for content as much as it's been, looked at for technical qualifications to meet publication status. That might be a high number, but there's a lot of submissions that come in that don't meet the criteria to actually get put forward. But then once you fix that, now it gets thrown into peer review. Then at that point, it could get rejected, accepted, or anywhere in between. So there's what I would say is the key takeaway from this is that if you're not sure if there's something that would meet some of the technical qualifications, maybe reach out to MedEdPORTAL staff first. Before you make the submission. And maybe the second piece, maybe don't just suggest, or just to keep in mind, is that the staff there is actually very willing to help. The associate editor is usually in the context of a reject or a revision sort of decision, would say, hey, we're willing to work with you to make this something that can get accepted. Very few pieces, though, will come totally through the queue and very few get an accept on the first run. So I would expect that, like with any other journal, that you'd probably go through a minimum of a round of revision, because nothing's probably perfect at first pass.
Yeah, I would echo that. And I think as opposed to a lot of other journals, what happens is a lot of times you submit and it gets right into peer review, and then you're getting those rejections at that point. Whereas what I think Mike is alluding to here is that we have this first sort of gatekeeping process. Most of the things that I'm seeing as an associate editor when they come through, like Mike said, they get accepted, or usually it's one round of revisions. I, as the associate editor, don't reject too many things. I don't think Mike or JP do either. It's really the staff, those gatekeepers who are making sure that it's the right fit. So in terms of, and these are some of the things, right? So these are some of the areas that may prevent something from going forward. Things like what type of images can be included. And so you need to be able to own the copyright. So the author has to own it. Copyright, you have to either obtain the permission and have patient participant consent obtained, or have it be identified. So in the images you saw there, Things from Shutterstock obviously are not owned by you, so you can't utilize those. Images that you take, pictures that you take, totally fine as long as you can, consent and have, whether your patients are consented or whatnot, or your learners are consented. The image on there of the whiteboard, right? If you draw something on a whiteboard screen and you take a picture of that, totally acceptable. De-identified images of x-rays as part of your case materials, totally acceptable as well. Patient images, we don't like to see those, as we don't find there's a huge need for them in the submissions that we see coming through to MedEdPORTAL. So what is the scope of MedEdPORTAL is in essence what question 5 was getting to. And so MedEdPORTAL invites educators to submit generalizable educational materials. The learners must include training or practicing physicians or dentists. It may include trainees or practitioners from all the other professions as well. So what this means is if you happen to be a faculty, like Mike is at a nursing school, and you run a really innovative program with your nurse practitioner students, unfortunately, it cannot be submitted to MedEdPORTAL. However, if you run that simulation or that skills training or whatever it might be with a handful of med students and nurse practitioner students and or residents, because you've included medical learners in it, then you can submit it to MedEdPORTAL. You could also utilize dentists. I worked at an institution where we had a dental residency program. We were doing some sort of case that took place in the dentist's office with bupivacaine spray. And we just had, 8 or 10 dental students participating in it. That can be accepted to MedEdPORTAL. But if you do a curriculum for your emergency nurses, that cannot be accepted. So you must have a medical or dental student, trainee, faculty member as a learner in your program. All right.
So there's sometimes this discussion about maybe expanding the scope to make it more interprofessional, but at the moment it's not there yet, with the exception of medicine and dentistry.
So the 3 collections that are within MedEdPORTAL are the opioid addiction and pain collection, the diversity, inclusion, and equity collection, and the anti-racism collection. And these are collections, these are resources that get put under these collections for easy searching within MedEdPORTAL. And there are special calls for curriculums related to these topics. And so these collections can be added to at any point in time, but these are the 3 that are currently exist within MedEdPORTAL. And then you all did a great job with this one, just making sure that we all have an idea that what we're talking about here is really Glass-Steagall's criteria about educational scholarship and how do we disseminate our scholarly work from the educational perspective. But being familiar with the Bloom's taxonomy and levels of learning is important. A lot of the verbs that we want to see when you are writing objectives for your submissions to MedEdPORTAL need to be tailored correctly so that your verbiage and your objectives matches your evaluation and outcome measures. That's one thing that we do see in submissions to MedEdPORTAL where they're not congruent, and that's oftentimes what gets sent back. Being familiar with Kern's model of curriculum development, a 6-step model, being able to speak to that and how you developed your curriculum, the needs assessment, your general and focused needs assessment, the content that you created and why you created it, the process that you went through to implement it and evaluate it. That continual cycle of refinement and development is an important part to your submission. And then Kirkpatrick's levels of evaluation is also really important. MedEdPORTAL doesn't require the highest level of Kirkpatrick evaluation of translation to practice. We do live at the lower levels of evaluation of did your learners like it? Did they learn something? But what we really do want to see, and we'll talk about this in a second, is the refinement of the curriculum and us as associate editors and Grace Huang from Boston as the editor-in-chief wants to see that you've evaluated and modified the curriculum as necessary to meet your objectives. Again, we assume everybody's familiar with these concepts, but being, really intimately familiar and understanding how this factors into your submission process and how this rounds out your submission is really important. And so what are some of the activities that readily translate to MedEdPORTAL? Things like discrete workshops, reasonably sized active learning elements, that you have concrete learning objectives. Those are all really good submissions to talk about. Team-based learning or problem-based learning. Those are all really good submissions to MedEdPORTAL. Obviously, simulation lends itself really nicely to MedEdPORTAL submissions. And then interactive modules, kind of like the module we just did that was built using Storyline Articulate or Adobe Captivate. So you can build computer-based modules. You have to submit the file that's exportable for local use, has to be easily distributed, but you can create online content and get the peer-reviewed citation for that work. And that's really the focus of MedEdPORTAL, is that distributable curriculum content that other journals just don't accept. And so some of the reasons for rejection, if it's been widely disseminated already. So if you've posted a video on YouTube, that may be a problem. If it's got 1 million hits on YouTube, can't be submitted to MedEdPORTAL. If you've hosted a video on YouTube, you've linked to it internally, you've had 100 people view it. If you take it down off of YouTube, that would be fine. Then it could be submitted to MedEdPORTAL. The other reason that content gets rejected is that it describes a process rather than the generalizable activity. There's an over-reliance on external sources or programs. So if you're submitting something that's talking about the AHA ACLS program and how you utilize that, that's an over-reliance on an external program. However, if you're telling us about the rapid cycle deliberate practice program that you implemented based upon the AHA guidelines, that's a new educational modality, a method of teaching that you're utilizing, you have outcome, that would be something that would be publishable. The passive and reference-like resources. Again, this has to be about your active curriculums that you are submitting that others can then go ahead and implement. So some case scenarios. Let's talk a little bit about what we see being submitted and what you may be submitting yourselves. So if you're interested in submitting to MedEdPORTAL, let's take a look at this. So whether you want to take yourselves off of mute or type it into the chat, either one is fine. But do you think we would accept a 10-minute orientation for new medical students that includes icebreakers, a quick needs assessment, and setting shift expectations? This is a an intro to your shift or your orientation to a new medical student who's coming into the emergency department or to their clerkship. What do you think? Yes, no, not sure, unlikely, I see. Whys, ands, and question marks are all acceptable.
So one of the questions there, Jared, is, there's a comment of unlikely, but then there's another question that says, what if this had an evaluation process to it? Like if it was an orientation and there was some sort of evaluation piece to it.
Yeah, it's a good question. Any other thoughts before we answer that? Yes, no, do you think this would be accepted? Or can it really, it's shame on us for wording it. Can they submit it? Sure, they can submit this. Now, whether or not it makes it past the screening process is a whole nother question. So this would likely not make it past the screening process. It is not focused enough. This is probably something that is done at every institution in some form. It's probably very localized. There's not enough content here for it to pass the initial screening of the staff editors or the associate editors. It's just not built out enough. If you were doing an orientation program that included some skills and it was a 2-hour-long program, some didactic and some skills and some other components to it, then yeah, an orientation can be accepted. But a quick 10-minute, an icebreaker, and some shift assessment, there's nothing there's no learning activity that's really taking place here. Mike, anything? JP, anything you want to add to that?
I've been throwing some comments in the chat.
Yep.
So yeah, the real point that Jared's making, like, does it have enough there that makes it generalizable? So the idea about having an evaluation, I'd say that would be sort of interesting. And if there were more activities in here that were a little bit more generalizable. So let's say these are new medical students and it was about the skills, the essential skills that they might need to work in the ED. And there was a curriculum built around that, and maybe a pre and post assessment or some skills assessment, then we're getting closer to something that would actually go through and maybe go to peer review. And then it depends. At that point, like how does this, how rich is that? How rich is the data? How many learners? What's the experience and the reflective critique that's occurred with the work?
Great. So what do you think of this? Can they submit a 5-minute YouTube video they made demonstrating a trauma-informed care physical exam? So we already gave you a hint about YouTube videos. And again, they can submit it, whether or not it makes it through the process. But for this one, a 5-minute YouTube video would probably be part of a larger curriculum. Maybe it's the pre-course to a simulation. Maybe it's the pre-course to a discussion component that they're going to have later on. But the YouTube video would have to be taken down as we discussed. And in and of itself, it probably wouldn't pass the submission screening process. But built out again into a larger curriculum, then it probably could.
I wanted to, Jared, I just wanted to clarify back on that. So if you included that video as part of this submission, and the piece that Jared's referring to also, he said he's going to be part of something bigger. So as we sort of move forward, we'll sort of describe the submission itself includes the description of the actual activity or activities, plus the, let's say, the results and the reflective critique. And that's usually encapsulated in what's called an ESR, or an educational summary report. But the video itself would be part of an appendix. So it's going to be an attachment that makes it possible for a reader of the article to put it into play. So the video itself is nice. It's probably very valuable, but it's only valuable if it's contained within the larger construct of the whole lesson plan, including the educational summary report. A lesson plan that's also been enacted and has been thought about and then has been run a couple of times to sort of debug it. That sort of idea.
Great. So what do you think of this one? This one gets a little bit more complicated. Again, they can submit it, but should they submit it, I guess is a better question. A simulation case on lidocaine-induced methemoglobinemia in kids. Yes, no, question mark. Should this come to MedEdPORTAL? Yes. Let's see one answer. Bunch of yeses. So this leads to a lot of great discussion. Is this a generalizable case? And thank you, Joshua, I see that. Is this generalizable enough? Is there enough interest in this from the community for others to search for it in MedEdPORTAL? That's the deciding point here, because yes, a simulation case, totally acceptable. Whether or not there's enough call for this in the community of practice would be really the question that that needs to be answered by the screeners at this point. And I think it could go either way. If the authors themselves make a clear, good case in their documents as to why this is an important case and why others would utilize it, then absolutely it could be accepted. And so I know we have about 10 minutes left here. I see Sarah's question. Is there a unit of submission that is too large? If I run a longitudinal training program, should I be submitting individual models or the entire thing? That is a really great question. We have gotten submissions that are, 10 weeks long, and we get 10 modules with 10 appendices that are 14 pages each, with a bunch of different simulation cases. If you've evaluated the entire process at the end, then I think submitting it as an entire module is probably the right way to go. However, if you evaluate each simulation case after it's run, you can create sort of your own compendium, and you can work with the staff at MedEdPORTAL to do this, where the files are linked together. So you would submit each of them as an independent resource. You would get a publication out of each of those resources, and then it falls under the larger umbrella. So there are two ways to go about it. And then I see JP jumped in. One approach is to implement among different cohorts to showcase its worth through the evaluation. So peds and family medicine and med peds. And then I think, Mike, you also kind of jumped in there about linked or serial submission versus one large submission. The review process is a lot more difficult with the larger submissions. So I would definitely reach out to the staff at MedEdPORTAL, the faculty mentors who are listed on the website. You may even have one at your own organization, or even reach out to one of the associate editors before submitting a large resource. Just so you can see what's been searched for over the last 3 months on MedEdPORTAL. These are some of the topics that have been searched for. Is simulation and pediatrics and virtual patients and social determinants of health. And so you can see what resources are being used. Mike mentioned this a minute ago, but ESR is the educational summary report. That's really your scholarly work. And your appendices are your scenarios, your scripts, your assessments, all that sort of end product, the product that goes into implementing your curriculum. So the ESR needs to have your title, your objectives written in a SMART methodology, the abstract, introduction methods, and then if you're doing simulations, the equipment, the personnel, the implementation component, the assessment, the debriefing. If it's a problem-based learning, you would have a little bit different sections, obviously, your results and your discussion. And this is what the end product looks like. It is a scholarly publication. This is what your MedEdPORTAL submissions get turned into. And so it's an accomplishment. So real quickly, we'll pose some questions. What do you think of these objectives? So by the end of the module, the learner will be able to demonstrate an appropriate initial approach to critically ill newborns, including ABCs, identify impending neurological decompensation and coagulopathy, and formulate a diagnosis, develop and execute a management plan for a patient with a seizure and acute cerebral hemorrhage, and understand effective team leadership roles and communication. So what do you all think of those objectives? And you can take yourselves off of mute. You can type it into the chat. Any thoughts?
So Lee is mentioning that there's a lot of stuff.
Yeah.
Like maybe there's too many objectives to be feasible for the work.
And I see that folks from Medical College of Wisconsin are saying are very broad objectives. So some of them are sort of tailored and narrow. Some of them are a little bit broad. The things that I pick up on when I look at this from a high level are the verb understand, which is not a measurable verb. So that's something that would definitely be sent back for revision. And what I like to call double-barreled objectives, develop and execute. How do you measure that, right? If they develop a management plan, did they meet that objective? What if they develop it but don't execute it? What if they talk about it out loud but don't actually get to the implementation phase? So that's not necessarily a measurable objective. So those are two of the things that stand out to me when looking at these objectives, just simply about the verbiage. And that's really where we live a lot of our time and responding to comments and critiques of the objectives of, do they align to your outcomes? Are they measured? And are they measurable? So that's something to consider. And so we were highlighting those there. So in a method section, this study utilized a convenient sample of dental residents who completed a pre-post assessment of their confidence after completing a simulation-based curriculum focused on dental emergencies. What do you think? Good, bad?
I don't like assessment of confidence because people can be overconfident or underconfident, and it doesn't actually speak to their competence at all.
Sure. So The confidence piece, if you do a pre-post confidence, we're okay with it, right? It's a really low level. It doesn't talk to competence. The piece that we pick up on here is the verbiage about a study using a convenient sample. MedEdPORTAL doesn't publish studies. MedEdPORTAL publishes curriculums. So it's really about reframing this about the educational curriculum that you implemented and your assessment of the curriculum, not of the individuals. Does that make sense?
Yeah, a lot of our institutions now value educational scholarship as, pretty much equivalent currency for promotion and tenure as compared with research. But medical education research from the AAMC sort of viewpoint would probably go to academic medicine. For the scholarship would probably go to MedEdPORTAL. I would say that, so then the educational research in the EM world, especially at SAEM, you could probably put educational research or scholarship if it's got a good research component or sound innovative methods, and that might go to academic emergency medicine education and training, or just straight up academic emergency medicine.
And so here's the sample results. I know we only have a couple of minutes left. What I want to point out here is that when we're talking about 8 participants completed the submission over a 3-month period, 8 is not usually a large enough end. And then when I said this the other day, Grace, our editor-in-chief, said, don't waver on that. 8 is not a large enough sample. 10 is the bare minimum. 12 to 15 participants is really where we want to see submissions come in at. The little asterisk that we like to put next to this is something about like dermatology. If it's a really specific, case, really specific skill that's being taught, and you only can do this with dermatology fellows, and you only have 2 dermatology fellows in a year, right, who are going through it, and you've done it over 4 years, you may only have 8 participants. This is where we would tell you, reach out to other departments that may need to participate in this procedure. Reach out to other organizations and have them engage with you to increase your size of your N. So a couple of last minute points and some caveats. You have to adhere to scholarly writing and ICMJE standards, which is the International Commission on Medical Journal Ethics. You must have been implemented and evaluated. Your materials must be packable and generalizable, but you do get to keep the copyright for it. So if you're ready to submit or ready to review, you can go to mededportal.org. You can reach out to faculty mentors or go to the faculty mentors page on MedEdPORTAL. It lists who they are and where they are. And if you have any other questions that we didn't get to cover today, feel free to reach out to myself or any one of the folks that you see on this list here. We are all associate editors at MedEdPORTAL, and you are welcome to reach out to us. Please, the only thing I would say is probably don't send us your curriculums asking us to review them prior to submission. But if you have questions that you want us to look at, you want us to look at the objectives or just review anything, feel free to reach out. We're happy to do so. So I think we're right on time here, but if there's any questions, we're happy to take them. You can take yourselves off of mute or put them in the chat. And we're happy to have a bit of a conversation about anything. And Mike, JP, anything you want to add?
I threw some items in the chat.
Yep.
So just take a look there.
Mike has been typing away, although I think Mike secretly had these already pre-planned and is copying and pasting. I don't know.
No, I'm typing. but I would maybe the only point I would say is if you have a small sample, or even if you don't have a small sample, just consider a mixed methods approach to the assessment and evaluation. It doesn't necessarily make it research. It just makes it great scholarship. And so I do draw a line there. What's scholarship? What's research? Classics is usually the way to sort of set the bar for that.
I know, JP, you're on a train, but if you have any comments, feel free to chime in or put them in the chat like you have been doing. But does anyone who's participating today have any questions or concerns, or did we allay any of your fears about submitting to MedEdPORTAL?
Maybe if I can make one last point, is just to think educational scholarship as you design, because anything you're doing now likely could get converted into educational scholarship, let alone research, and you could probably put it forward to MedEdPORTAL and get, sort of knock off 2 agenda items with the same effort.
I'm always quite surprised when I work with faculty members in my organization. They may be familiar with it, but are intimidated by by going through the process. It's pretty formulaic. I will even say I submitted something to MedEdPORTAL. It got returned to me twice for revisions. So it's an iterative process. Nothing's perfect the first couple of times it goes through. And I'm appreciative of my colleagues who give me feedback and talk about how we can strengthen it for future. But, take that first step, reach out to us. We're happy, to help. Reach out to those faculty mentors at your organization. But as Mike said, think about as you're developing your curriculum, how are you assessing it? Are you following the current 6-step model? And, the package of it is just the writing at the end of the day. So with that, we would thank you all so much for participating and coming today. And Leah said she's published once on MedEdPORTAL, and she's validating our statements, right? The process was supportive and easy to navigate. Not just our word anymore, it's somebody else's.
Well, thank you guys. Coming from an educational team that has really been thinking about how we can up our game as far as scholarship, this is really helpful to kind of drive home some key points on what we can do to get into MedEdPORTAL. So I appreciate it.
I find it so valuable, especially for our junior faculty who are on the clinical educator track. And how do you, when you go and meet with your chair or your program director, and you want to demonstrate, the work that you've been doing, these are all peer-reviewed publications, so that when you go up, check with your organization. I know my organization specifically calls out submissions and citations from MedEdPORTAL are accepted for promotion and tenure. So it's definitely something you need to be thinking about. And JP is typing furiously on his phone or computer there, but he put his email in the chat for DEI curriculums. So reach out to him. That's his focus. Mike's area is obviously EM and simulation. JP again says reach out to the faculty mentor. It saves you and us a lot of time. We can't stress that enough. And again, my area is interprofessional education, simulation, and even standardized patients. So if you're doing work with standardized patients, you can submit those curriculums as well. Undergraduate, graduate, continuing professional development, all that stuff, all right for MedEdPORTAL. Thank you all so much for joining us today.
Sounds great. Have a good day, everyone.